PADnet tip, obtaining a good ABI. Part 1, placing the PPG probe. On the hands, the best place to get a pulse is on the first or pointer finger or on the second or middle finger at the first or second joint. On the feet, the best placement of the PPG probe is on the pad of the great toe. Be warned, taking the pulse on the feet can be difficult if the toes are cold. When toes are cold, the arteries inside contract, moving the blood farther away from the surface and making it difficult to get a strong pulse. Take action at the beginning of the test to make sure the patient has warm feet when you need them. Leave the patient's socks on until the pulse is needed, or place a blanket or towel over the feet to keep them out of the chilly air. When the PADnet test is started, it will first ask you if the PPG probe is displaying a pulse. If the PPG is showing you a regular, even pulse with peaks and troughs, you are in good shape. However, if it shows you an uneven pulse or noise, you may need to adjust your probe and try again. Part 2, selecting the return of flow. After you've informed the PADnet software there is a strong pulse from the PPG probe, you're able to start the pressure test. The cuff will inflate and then slowly deflate before presenting you with a return of flow trace. When selecting the return of flow, the goal is to select the first wave of blood found in the return of flow trace. The system works by occluding or tightening the vessels to cut off circulation to a particular segment that is being tested. Once cut off, the system will loosen and the flow of blood will begin to return. Your job is to select this returning blood flow. Selecting the return of flow is not always easy. Due to patient movement, calcified arteries, or other reasons, the return of flow isn't always as easy to select. Luckily, for cases like this, there is another option for the PADnet device to automatically select the return of flow for you. By clicking Can't See Return of Signal, the PADnet software will use pneumoplethysmography to calculate a systolic pressure. However, it is important to compare this system selection with your best guess. The pressure at the currently selected location is displayed on the bottom right of the corner of the trace. If your guess and the system's selection are wildly divergent, greater than 10 millimeters of mercury's difference, it's recommended you redo the pressure at that segment.